Vasudhaiva Kutumbakam is the principal motto that we follow at Symbiosis International University, which means world as one family. Symbiosis proves to be a ground that nurtures and cares for all the students, immaterial of their background, who not only come from different parts of the country, but from all over the world.
We don't just coexist, but we work together and learn together in a way that benefits each and every one of us. I guess that indeed explains the word symbiosis and our university we so proudly represent.
Good afternoon, guests, delegates, and everyone present here today. I, Neha Raghu,
And I, Anushka Rai,
students of MBA, Hospital and Healthcare Management from Symbiosis Institute of Health Sciences, on behalf of Faculty of Health Sciences, Symbiosis International University, welcome each and every one of you to the Valedictory ceremony of SYMHEALTH 2022.
in consonance with transformative paradigms, the Faculty of Health Sciences has organized SYMHEALTH 2022, a two-day national conference on transforming healthcare to empower allied and healthcare professionals, promote development, inculcate advanced technology to clinical practices, and understanding diagnostic and therapeutic modalities.
The objective of the conference is to create collaborative links between academics and professional practitioners and their workplace, aiming at long-term sharing of knowledge and discussion of current issues in the domain of healthcare. At SYMHEALTH 2022, we witness a series of talks on various topics in the healthcare domain, a blend of expertise delivered by an esteemed panel of speakers. I'm sure everyone found these sessions intense, intellectual, and insightful.
Today's valedictory ceremony shall mark a defining point in the lives of the delegates who have completed their postgraduate diploma programs in various disciplines. Before we begin, let us take a walk down memory lane to trace the humble beginnings of the Faculty of Health Sciences to the unveiling of the Arogya Dham on the 6th of March 2022 by the Honorable Prime Minister Shri Narendra Modi. We welcome our dignitaries for the evening. I request Dr. Rajiv Yeraudekar Sir, Dean, Faculty of Health Sciences, to accompany the following dignitaries onto the dais.
Dr. Raman Ganga Khedkar, CG Pandit, National Chair, Indian Council of Medical Research, New Delhi. Professor Dr. S.B. Muzumdar Sir, Founder and President, Symbiosis, Chancellor, Symbiosis International University.
Dr. Vidya Yeraudekar Ma'am, Pro-Chancellor of Symbiosis International University, Principal Director of Symbiosis Society.
Dr. Rajni Gupte Ma'am, Vice Chancellor, Symbiosis International University.
Ladies and gentlemen, put your hands together once again in welcoming all the dignitaries with a big round of applause.
We have with us Dr. Rajiv Yeraudekar Sir, Dean, Faculty of Health Sciences, Symbiosis International University. Dr. Rajiv graduated from prestigious BJ Medical College, Pune, and is a gold medal awardee at MD Obstetrics and Gynecology. Sir topped the Maharashtra Public Service Commission examination and was awarded PhD under the Faculty of Management at Pune University. Dr. Rajiv has also served as member of Board of Governance of Medical Council of India, Central Supervisory Board, Maharashtra Medical Council, and professional organizations like FICCI Nat Health. Dr. Rajiv has been nominated by Honorable Governor of Maharashtra and Chancellor of the universities in the state as the Chancellor's nominee on the Senate of Maharashtra University of Health Sciences. I now request Sir to provide his insight on SYMHEALTH 2022. Welcome, sir.
Good afternoon, everyone. Chief guest for the valedictory function, Dr. Raman Ganga Khedkar, CG Pandit Chair of the ICMR, the Chancellor of the Symbiosis International University and Founder President, Dr. S.B. Muzumdar sir, the Pro-Chancellor, Dr. Vidya Iravdekar, the Vice-Chancellor, Dr. Rajni Gupte ma'am, Directors of the Constituents of Symbiosis International University, including the constituents of the Faculty of Health Sciences, heads of departments of the Faculty of Health Sciences, faculty members, students of the Faculty of Health Sciences, some of them are sitting in the adjoining room at the convention hall, and most importantly, my dear students who have completed the various programs under the Symbiosis School of Open and Distance Learning. I see in the audience very eminent people, Dr. Tutakne sir, Dr. Jamkar, both eminent distinguished professors at the Symbiosis International University, Dr. Natarajan, the CEO of the Symbiosis University Hospital and Research Center, Dr. Vijaya Sagar, the Dean of the Symbiosis Medical College for Women, and various other dignitaries. Well, before I come to the proceedings of the 2 days SYMHEALTH 2022, in a lighter vein, you are all witness to the excellent talk given by Sanjay Oak this morning on interprofessional education. And he probably made it more interesting by giving a Bollywood tinge to it. He spoke about the song in Lavaris, and my voice is not too good, but the lyrics run as Mere Angane mein tumhara kya kaam hai, and then Sati Haath Badana and all that. But I wish to tell this interesting young population here, the diverse group of students and healthcare professionals who are assembled here, that SYMHEALTH 2022 is also a conglomeration and a symbiosis of many personalities and many dignitaries who have synonyms or who are represented in Bollywood. Why do I say that? Our film was made by Mr. Dharmendra, who heads the Symbiosis School of Photography in the studios. So Professor Dharmendra, if you're here, he made the film. अगर धर्मेंद्र है तो हेमा मालिनी आनी ही चाहिए, तो कल आई थी. हेमा मालिनी spoke on nutraceuticals, functional foods and supplements. We also have a Jatinder Kumar Saini, who is the director of the Symbiosis Institute of Computer Studies and Research. So Jitendra is Jatinder, of course. We also have a Shashikala. She is the Dean of our Faculty of Law. We've got a Raman Ganga Kherkar, synonymous with the eminent producer director Raman Khosla. Perhaps the icing or the cherry on the icing of the cake was the thespian Dilip Kumar this morning as the president of the Indian Nursing Council. So Bollywood is very much religion even at Symbiosis. Well, the 2 days, as the Compe said, has seen an eminent list of dignitaries from various domains and verticals of the healthcare sector, getting a lot of industry expertise and exposure, getting a lot of academic inputs. And basically, sir, you were there yesterday when you judged the posters and the presentations, paper presentations. We grouped them into 3 groups. One was the hospital and healthcare management related programs. So we had workforce challenges, we spoke about healthy hospitals, we spoke about healing hospitals, we spoke about Gen Next hospitals, we spoke about digitization, we spoke of artificial intelligence and stuff like that. We also had programs and talks for allied healthcare professionals. So the idea was to not neglect the allied healthcare professionals, which is the very essence and the theme of SYMHEALTH 2022. So we had the nutritionists and dietitians spoken by various eminent subject experts. We had a talk on clinical research, and this audience includes a lot of practicing doctors who find reason and time, lack of time, as the reason for not publishing and not undertaking research. And Dr. Gupta is nodding in congruence to my thought process, because research is the bane, and probably research is where we all need to pull up our socks. And then we had tracks specifically for the nursing and the medical profession and the medical technologists also. So we got the Symbiosis Medical College for Women, the Symbiosis College for Nursing, and the medical technologists, which represent the major dominant force of the allied healthcare professionals. But going beyond these narrow tubular lanes of domain-specific knowledge, information, skill sets, competencies, from this morning we've had a couple of talks to broaden and unfold the horizon of healthcare professionals. So the talk on healthcare diplomacy, the talk on interprofessional health education, and can we really function without our nurses? And therefore the apt title of What Ails Our Nightingales is a reflection of what ails our health systems. The COVID-19, dear friends, has exposed a fractured public healthcare system, and the vertebral column of this public healthcare system are the nurses. They are the allied healthcare professionals. And much and due respect to the allopaths sitting in this audience, and I represent that allied group, MBBS doctors, sir, are an extinct species today. In the periphery, why even in the city of Pune, it is extremely difficult to run a hospital only with MBBS doctors. And the non-MBBS doctors, whether they are BMS, BHMS, even BUMS, are the ones who provide the much needed support to the consultants and the specialists who are in different domains. So we do rely heavily on the allied healthcare professionals. And seminars or conferences or deliberations like the SYMHEALTH therefore seek to highlight the importance of the allied healthcare professionals, whether they are technologists, whether they are public health professionals, whether they are dietitians. We need to understand that we need to raise a cadre of allied healthcare professionals. We need to raise a cadre of technology-savvy healthcare professionals. So the next genre, a cadre of healthcare professionals, would be the digital healthcare professionals. We need to understand that today's healthcare professional needs to imbibe 21st century skill sets. And what do I mean by 21st century skill sets? It is the synergistic collaboration, adaptive agility, multidisciplinarity, the ability to work in teams, the ability to understand each other's viewpoints, and the ability to emerge as a team. Understanding fully well that team is not a word. Team is an acronym for together, each one achieves more. And as we understand this, we need to be abreast with global changes, how healthcare is being used as a soft tool for fostering and promoting international relations, for forging diplomatic ties. So healthcare cannot and should not be viewed in isolation in ivory towers, but we need to function as a part of a larger societal ecosystem. So welcome all to SYMHEALTH 22. You have finished your 2 days contact session as a mandate for the distance education program students, but I'm sure the other students of the Faculty of Health Sciences, along with the faculty, have emerged a well-informed and a better informed healthcare professional. Congratulations to all of you. God bless. Thank you.
As Rajiv sir has spoke about his love for Bollywood, we would like to believe sir is the Raj Kapoor, considering of Faculty of Health Sciences, as he is involved in the production, direction of all events at the faculty. Thank you, sir, for addressing and giving us an overview of SYMHEALTH. We now request Honorable Professor Dr. S.B. Muzumdar, sir, founder and president of Symbiosis, Chancellor of Symbiosis International University, to felicitate our chief guest, Dr. Raman Ganga Khedkar. Thank you, sir. Research was an integral part of SYMHEALTH 2022. We had received 70 abstracts and papers for the competition, out of which 51 were chosen for poster and 15 best paper was chosen for oral presentation. The jury members were Dr. Raman Ganga Khedkar, chairperson, Dr. Sandeep Salvi, co-chairperson. The jury members were Brigadier Saurav Sen, Dr. Savita Jadhav, Dr. Sachin Palve from Symbiosis Medical College for Women, and Dr. Kavita Menon, Dr. Pramod Mishra, Dr. Samir Fadnes, and Dr. Raghupati. 3 prizes for poster and 3 prizes for oral were chosen by the jury.
First, we have the winners of the oral presentation. I request Professor Dr. S.B. Muzumdar sir and Dr. Vidya Yeraudekar ma'am to distribute the prizes to the winners. The third place goes to Mansi Doshi and group from MBA Hospital and Healthcare Management. The second place goes to Samiksha Vasan and group from BSc Medical Technology. The first place goes to Dr. Rohan Shah and group from KEM Hospital and Research Center. Next are the winners for the poster presentation. I request our chief guest, Dr. Raman Ganga Khedkar sir and Dr. Rajni Gupte ma'am to distribute the prizes to the winners. The third place goes to Lakshmi Kumari and group from MBA Hospital and Healthcare Management. The second place goes to Dr. Neha Patil and group from
Let's give them a
MBA.
big round of applause.
The second place goes to Dr. Neha Patil and group from MBA Hospital and Healthcare Management. And the first place goes to Mayura Apte and group from Symbiosis School of Biological Sciences. Thank you, sir. Thank you, ma'am. We are fortunate to have with us a distinguished guest today, Dr. Raman Ganga Khedkar, CG Pandit, National Chair of the Indian Council of Medical Research, New Delhi. Dr. Raman was the former head of the Division of Epidemiology and Communicable Diseases in the Indian Council of Medical Research, New Delhi. Sir also served as the director of the National AIDS Research Institute, Pune, and was also a member of the Governing Council of the AIDS Society, India. Sir has also been a member of the National Advisory Board of the HIV Medicine Association of India and a mentor at the National Data Analysis Plan, National AIDS Control Organization. Sir is the chairperson at IEC, Symbiosis International University, Pune. He is also the recipient of various accolades such as the FXB Fellowship, the Francois Xavier Bagnoud Foundation, Switzerland, and the Fogati Fellowship. Dr. Raman was also awarded the Padma Shri in 2020. I now request Dr. Raman Ganga Khedkar to address the gathering.
Professor Muzumdar, Dr. Gupte, Dr. Vidya Yeraudekar, Dr. Rajiv Yeraudekar, and all the dignitaries of the dais and friends. Yesterday I read for the first time the agenda of the whole two-day conference. But I was too late in reading. Today I feel worse. I feel I should have been on that side because there were so good talks that you had to learn from. They could fire your imagination, your perhaps ability to think, decide and set new goals, because all of them were futuristic. Being young, whatever profession you choose, whatever domain you choose to specialize in, you would like to see that it has a sustainable future. And I was jealous. I never had these kinds of talks to listen to when I was young. I would have perhaps learned much more and could have done far more. Health is a sector which was traditionally, if you look at it, it was traditionally a neglected sector. COVID, fortunately, it brought it to the center stage. People started recognizing the value of health. It was not only policymakers, but even an ordinary human being, they started understanding the value of health per se. We achieved a lot. If you actually reflect upon, you will realize within 1 year's time, we could develop vaccine world over. We could immunize now huge population across the world. We could even think in terms of daring to say that our adult immunization experience, despite being far too lesser, excepting for pregnant women, we did really well. You look at medicines that have been developed, they took time, but now you have one of the best medicines, Paxlovid. You look at the development of different apps at that juncture, and you realize we could even monitor implementation of programs, and really well so. If you look at one of the biggest achievements at district level, now you have platforms which can actually do molecular level tests. That was something unheard of. Diarrheal diseases, they also become less. You look at involvement of the community to understand preventive aspects for COVID. It was really nice. But there are 2-3 things which will perhaps make our lives very difficult. One of the things which we have to realize is COVID is not yet gone. Perhaps if a new variant comes up in China, it may not be related to SARS-CoV-2, but it may be an absolutely new coronavirus that may come if they are unable to control this particular infection. In COVID, one of the things that happened, we lost track of other communicable diseases. You look at TB, the death rates are high as of now. New infections are also higher at this particular juncture. And you have a goal that PM articulated some time back, that TB will be eliminated in 2025. There is going to be a flurry of activity in next couple of years' time. New and newer strategies are going to be tried. The program will be monitored every week because the challenge is immense. We also lost track of other diseases which were disease elimination goals for 2030. How will we make it up? We really do not know. Though COVID brought health to center stage, we must also realize that we have spent huge amount of money on COVID. The result is, my gut feel, perhaps you will find it difficult to get good allocation in health now because the priorities are changing because of geopolitical risks that have added further to the COVID pandemic. You have to balance, no? Today, if you actually look at the allied professionals are more required in urban areas where tertiary care is actually important for delivery. The efforts to increase the level of healthcare to be provided at district level has started of late. They are going to create ID blocks at all district levels. There would be 10 ICU beds all across. But at the same time, the pace is also likely to be lower. One of the bigger challenges that all allied professionals will perhaps have to face is to do a good advocacy to integrate well both in the urban healthcare as well as primary healthcare. And that would be a key challenge for all of us. The only way your advocacy can become successful is you need to have good skills. Today, while we were discussing, I came to know for the first time that there is some respiratory course that you had. And I didn't know. The first thing I told was none of us were aware. If we knew that such people are available who are trained to handle ventilators, during those first 2 to 3 months, perhaps we would have gone to them and we would have said, take over the task for the entire country. The reason why I'm telling this is only because you need to be good advocates. You need to ensure that there is visibility and then raise demands. I'm sure perhaps those issues will be tackled really well over a period of time. We will have to advocate for health to remain at the center stage for some time now. All the deliberations that you had perhaps are good for even preparing a proceeding. And I think we should advocate on each branch, each domain that the speaker spoke about, have good brainstorming sessions, and come out with suggestions for Government of India. That will create a brand image for symbiosis. But brand image cannot be only a responsibility of symbiosis. It's up to all of us. We have to work hard and ensure that the brand image goes up. I'm sure together, Symbiosis and all of you, we will see a brighter future which will also reflect on health outcomes. Thank you.
Thank you, sir. We are honored to have with us today Honorable Professor Dr. S.B. Muzumdar, sir, founder and president of Symbiosis, Chancellor of Symbiosis International University, a distinguished academician and educationist, a father figure to our Symbiosis family. Being the founder and president, sir has created Symbiosis, a multinational, multilingual, and multidisciplinary educational complex of repute. Dr. S.B. Muzumdar, sir, is a recipient of many awards and honors. The Government of India has conferred on him Padma Shri in 2005, and Padma Bhushan in 2012. In 2016, Sir was honored with D.Litt by Tilak Maharashtra Vidyapith, and he was the first recipient of Dr. APJ Abdul Kalam Memorial Award. It's a great honor to have you among us today, sir. I now request sir to deliver the presidential address. So please.
Namaste. Namaste to all of you. The chief guest of valedictory function, Padma Shri Dr. Ganga Khedkar, Dr. Vidya, the Pro-Chancellor of University, Rajni Gupte, the Vice-Chancellor of this university, Dr. Rajiv, Dr. Tutakne, the head of Vice-Chancellor of Health Sciences University, Dr. Bhamre, Dr. Vijay Natarajan, Vijay Sagar, and all delegates to this conference. I was really excited to see and to know that more than 1,000 delegates from different parts of India and almost all states of India have come together under this roof. To me, this looks to be a mini India, Dr. Ganga Khedkar. And the credit goes to Dr. Rajiv and his colleagues for organizing such a very two-day conference. It is a two-day conference, but they have spent more than 2 months in organizing this conference. So let us give greetings to Dr. Rajiv and his team. Please loudly clap it. Be that as it may, I hope your stay on the campus was comfortable, the food was tasty, the breakfast was nutritious, as Dr. Rajiv insists, and I wish there should have been some entertainment activities also. I do not know whether they were there or not. But next time I want all of you and perhaps more delegates to come to our campus. This is a wonderful get-together. And Rajiv has coined a new term. He has made noun a verb. He has made symbiosis into a symbiosing of allied health services. Well, friends, I don't stand here as expert in medicine, but I stand here as a common person who is confused, common person who doesn't know whether allopathy is good, Ayurveda is good, Unani is good. A common person, I only know that somebody should cure me. Somebody should take care of my health, whatever be the pathy. And when there is confusion, well, friends, you are in problem. You do not know whether this is true or that is true. सुरेश प्रभू यांची एक कविता आहे, गझल आहे. आणि ती गझल अशी आहे, एक साधा प्रश्न माझा, एक साधा प्रश्न माझा, लाख येती उत्तरे, हे खरे की ते खरे, की ते खरे की ते खरे, which means this is my simple question, but I receive lakhs of answers. And then I fell in doubt whether this is correct or that is correct or that is correct or that is correct. So my plea to you, all my friends, is let us forget allopathy, let us forget Ayurveda, let us forget Unani, let us forget Siddha. Can we not break these watertight compartments? When I was in Ferguson College, there was botany building, there was zoology building, there was chemistry building, there was physics building. अरे क्या चल रहा है? Why this divide? Why these walls between various disciplines of knowledge? Similarly, I feel that even in medicine, there are walls like Berlin walls between allopathy, even Ayurveda, allopathy, homeopathy. Can we not bring them together? Can we not have symbiotic relationship between these two patches? And to the layman like me, the best patch is sympathy. So I want sympathy, not particular pathy. And therefore, very often I feel that just as like a College of Liberal Arts Vidya, College of Liberal Arts, multidisciplinarity, which has been the soul of New Education Policy 2020, can you not have Dr. Ganga Khedkar, College of Liberal Medicine? Liberal medicine where you can choose one specialization if you want. But you should also know so many other things. Why not have a course from Ayurveda? Why not have a course from Unani, Siddha, homeopathy? In fact, person who is studying in College of Liberal Medicine should be jack of all trades. And there is an advantage to be a jack of all trades. So this is my plea to you, that please help me to answer the question. Another point that I would like to stress upon is that we have been underestimating nurses for all these years. And wonderful statement by Dilip Kumar, who was president of Indian National Nursing Council, was they are lowly paid and they don't have much social status. But Dr. Ganga Kher would agree with me, and Dr. Ashok, Dr. Oak, what a wonderful speech he gave. He said that more than doctors, it is the nurses who handle COVID patients better. And here is our CEO, Dr. Natarajan, who was telling me that 75% treatment during COVID period was given by nurses. Doctors were just watching them. And I have been advocating right from so many years, that nurses are our best assets. I had written a letter to President of India when Pranab Mukherjee was there, and my plea was, please give some bridge course to these nurses and qualify them to prescribe medicines. They will be our good asset, they will be our family doctors in many rural parts of our country. They learn nursing course for 4 years, 4.5 years. And still they are looked upon by the doctors, by the society, lowly paid for people. So there has got to be not only reform in medicine, but there has to be a revolution in medicine. And Symbiosis has decided one thing. Come what may, whether MCI or Commission or Council, forget it. We have decided to start a center of integrated medicine. Integrated medicine. Hell with licenses, permitrage and all that. Because as Vice Chancellor Oak mentioned today, deemed universities has certain advantages. They can violate all rules and regulations of statutory universities. So we want to start integrated medical course. But before that, we will also start integrated medical services. Under one roof, there will be doctors from allopathy, homeopathy, allopathy, Unani, and Siddha. And I am sure our Prime Minister Modi will be very, very happy. Because he is trying to promote Ayush. And Dr. Oak today told all of us, that Ayush has a great contribution to elimination of COVID. Am I right? So role of Ayush is also equally important. Role of homeopathy, role of Unani. So very soon you will find on this campus an institute of integrated medicine. Whether we will give certificate, whether we will give diploma, Vidya and Rajiv will take care. But this is what I feel, and I am sure all of you will agree with me that time has come. COVID, I tell you one thing, COVID was a great destroyer, but he was also a great teacher. And first lesson that COVID has taught us, come together, togetherness. And it is out of togetherness, it is out of coming together, working together, aspiring together, that there is a possibility of Vasudhaiva Kutumbakam. And that dream will be very much realized when we experience how important is the family relation, how important is intercontinental relations, how important is the cooperation and togetherness among people of different countries, of different nationalities. This is what Symbiosis stands for. So I hope this is a valedictory function. When you go home, you will take a message that it is the aim, the ultimate pleasure, the ultimate happiness lies in togetherness, lies in Vasudhaiva Kutumbakam. You are not safe unless others around you are safe. Let's resolve that in this conference we take away the spirit of Vasudhaiva Kutumbakam. Thank you.
Thank you, sir, for showering us with your words of wisdom and blessings. I'm sure the audience will incorporate the learnings from your words into their lives. I thank our respected dignitaries who have graced the occasion with their presence. We also thank the associate partners, press, the electronic media for their support and the delegates for their participation. I would also like to thank all the faculties of the Institute of Health Sciences and all the committee members for making SYMHEALTH 2022 a true success.
We all belong to one nation with diverse cultures, religions, and ethnicities. With freedom in our mind, faith in our words, and pride in our souls, we request everyone to kindly rise for the national anthem.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल उत्कलवङ्गा विन्ध्य हिमाचल यमुना गङ्गा उच्चल जलधितरङ्गा तव शुभ नामे जागे तव शुभ आशिष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे